Enter.
Hello, how are you today?
I'm doing good.
My name is Kelly, I'm your nurse. The doctor wants me to explain some of the medication that he's giving you, okay? So he's prescribed you with Risperidone. Oh my goodness. Here is a little pamphlet that I have for you.
Oh, thank you.
So if you have any questions, you can, don't hesitate to ask, or you could just kind of follow along if you need to, okay?
Okay.
So again, he's given you Risperidone. That is actually the generic name and the brand name. So that's the only name that you're going to recognize. It's under the classification of atypical antipsychotic, which is just a fancy way of saying that it's a newer version of the psychotic. So this version is going to address the highs of manic and the lows of manic. It's also going to address schizophrenia, so it's going to address the positive symptoms of schizophrenia, such as your hallucinations, both audio and visual, and it's going to address the negative, or the experiences that you have when you're feeling antisocial or you're feeling agitated.
Okay.
Risperidone is used to treat bipolar. It's used to treat schizophrenia. It's also used in autism or PTSD and depression. And in those cases, it's used to address the agitated anger types of issues and feelings that patients often feel with those types of diseases. The way that this works in the body is that it changes the way your brain can access the chemicals. So with the diseases, the illnesses that we've just described, your body produces too much of some of the chemicals, and so it doesn't eliminate the way that your body produces them. It simply changes the way your brain can use and access them.
Okay.
So some of the chemicals that we're talking about are dopamine, which is your feel-good transmitter. It also works on serotonin, the norepinephrine, and your histamine transmitter, which some of these are for the depression, the lows, and some of them are address the highs. And again, it works by limiting your brain's ability to access these chemicals. Do you have any questions about how that works?
So far, no. So
Okay.
just kind of takes the highs and the lows away.
Yes, kind of a mood stabilizer to kind of even everything out.
Okay.
So the expected therapeutic outcomes are going to be that it helps with the manic, the super highs of bipolar, and the feelings, the hallucinations that you feel with schizophrenia, the confusion and the disturbing thoughts. It's going to help with irritability and aggression, and we kind of just discussed that a little bit earlier.
Yeah.
Typically, it is prescribed in a pill form. It can also be prescribed in a dissolvable tablet that's placed under the tongue. It can also be prescribed in an injection form, which you would administer in the gluteal, the large muscle, which can either be done in a doctor's office, or we can teach you how to do that at home if that's the way the doctor prescribes the medication. He's going to come in a little bit and let us know exactly how he's going to prescribe it specifically for you.
Okay, perfect.
This medication should not be mixed with soda or beverages if you're taking it, and it can be taken, I know. Just don't, when you're taking the medication, don't take it along with soda or hot beverages. It can be taken once or twice a day, and it's usually prescribed in smaller doses, and then the doctor will build up. Everybody's a little bit different, so we've got to find the perfect formula for your particular symptoms and situation. So don't get frustrated. Don't quit taking it. Be patient, because it takes 4 to 6 weeks for it to work. You may experience some negative side effects. If you're allergic to it, of course, you're going to have a sensitivity to it, and it's not for everybody. It's not for patients with dementia. It's not for mothers who are breastfeeding, and it's not for people who spend a lot of time outdoors unprotected. So you're going to need to use sunscreen, wear long sleeve shirts, wear a hat, protect yourself from the sun. If you are going to, it's not for individuals that have a heart murmur, because it can affect the T wave, which is just a portion of the heart pattern. And we want to make sure that it doesn't affect that in a negative way. Some of the adverse effects, it can cause sleepiness or dizziness, so don't drive or operate machinery until we know exactly how it's going to affect you. A lot of patients experience weight gain, so you want to make sure that you eat healthy and you maintain a regular exercise routine. It may cause uncoordinated movements and muscle contractions, meaning that you may have twitching or pain. You're going to want to, if this happens, you're going to want to notify the doctor. Again, don't stop the medication abruptly. Notify your doctor and let him make adjustments. It may make you very thirsty. It may make you pee a lot. These are some diabetic-like symptoms which may occur. Again, you're going to want to notify your provider if this occurs. You need to call your doctor if you have the tremors and muscle twitching. You want to call your doctor if you have trouble thinking and finishing your thoughts, if your clarity is diminishing. You want to call your doctor if you're feeling restless or if you have uncontrolled leg movements. If you suddenly have to pee a lot or you find yourself that you're very thirsty.
Okay.
Again, this medication takes a while to work. Everybody's a little bit different. So be patient, call the doctor. Don't just stop abruptly. Let him make the adjustments for you so that we can figure it out specifically for you. Do you have any questions for me?
No, I think you did a great job.
Okay, perfect. Don't hesitate to call. We've got some information here and some phone numbers if you feel the need that you need more information, okay?
Awesome. Thank you very
You're
much,
so
Kelly.
welcome. Have a great day.
You too.
Thank you.